Meet Peter. He's clutching his chest and hunched forward in the waiting room. First, let's notice what's going on. Peter's most telling symptom is sharp mid-chest pain that actually improves when he sits and leans forward. He has a fever, his heart rate is elevated, tachycardia, and he's breathing faster than normal, tachypnea. When listening to his chest, we hear something unusual, a scratchy, grating sound called a pericardial friction rub. It sounds like two pieces of leather rubbing together. An electrocardiogram, or ECG, shows ST elevation, a pattern associated with irritation around the heart. His lab work shows elevated CRP, ESR, and WBC, three markers that all point to inflammation. So what does this mean? Peter has pericarditis, inflammation of the pericardium, which is the thin, fluid-filled protective sac that surrounds the heart. Think of it like a snug jacket around the heart. When that jacket becomes inflamed and irritated, every heartbeat rubs against swollen tissue, causing sharp, stabbing pain. Leaning forward shifts the heart away from the inflamed portion of the sac, reducing that friction. The most common cause of pericarditis is a viral infection. The virus triggers the immune system or directly attacks the pericardium. Now let's respond. The goal is to reduce the inflammation. The curative treatment is anti-inflammatory medications like high-dose aspirin or ibuprofen, and sometimes colchicine, a drug you might recognize from gout treatment. These medications target the inflammation directly, which reduces the swelling of the pericardium, relieves the friction, and lets the tissue begin to heal. Less inflammation means less pain. On the supportive side, activity restriction is essential. Pushing through normal activity while the pericardium is inflamed puts unnecessary strain on the heart sac and slows healing. Finally, let's reflect. Improvement means the sharp chest pain resolves and his fever comes down. In contrast, tachycardia with hypotension raises concern for cardiac tamponade when too much fluid builds up inside the pericardial sac and begins squeezing the heart from the outside, preventing the heart from pumping properly. In summary, pericarditis is inflammation of the protective sac around the heart. This swelling creates sharp chest pain and a friction rub. Anti-inflammatory medications are key to reduce the swelling so the pericardium can heal. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.